to go across now to Guyana, where we have on the line Dr. Shamdeo Basad, who is the Chief Medical Officer. Good morning, Dr. Basad. And can you give us an update on what is the situation now in Guyana?
Good morning, Lisa, and thanks for having me on. It's always my pleasure, and notwithstanding the sad nature of what we are all encountering now, please allow me to extend my condolences to all those who are affected here in Guyana, but also in Trinidad. This outbreak has had a really tremendous impact on our health services, but our society as a whole. And we are in full force implementing our control measures here since the detection of our first case.
Yes. Now, the person who had the first case, the woman, I believe she's 52 years of age, she had other complications. Can you clarify? Because although I know there have been press conferences and press releases, please clarify what was the situation with her. Did she die from COVID-19 or the related illnesses that were mentioned?
All right. Well, this is a sad situation. As a traveler, a Guyanese national who came back home, traveled to Guyana on the 7th, and had some underlying medical conditions, and started not feeling well. Was rushed to the hospital with some of the signs that indicated that maybe it's COVID-19 that actually was complicating her underlying conditions. We did the test, but of course we tried to manage her. The medical team there resuscitated her, they intubated her and tried to, give some life support, but eventually, unfortunately, we lost her. And the samples came back subsequently on that same day to say that it was positive for COVID-19. So, the usual thing is if someone dies so suddenly, we would have to have a post-mortem to ascertain exactly, but from all indications that it was the infection that actually compromised her well-being finally.
What is the mood in Guyana right now among the people, around the citizens?
People are a little apprehensive. There was a little bit of panic, but through the ministry, the minister, His Excellency himself, President Granger, made the announcement, and I think tried to appeal to everyone to really follow some of the simple measures that we are trying to put in place. The WHO Director General himself said that even though this is declared a pandemic, that this is the first time we have an opportunity where we can actually bring control with simple measures of a pandemic. So, we are really appealing for persons to understand, to seek and obtain correct information and not be misguided. We have noted, I'm hearing from sources that things are moving off the shelf, like hand sanitizers and things like that. There might be some economic opportunities for persons and things like that. But notwithstanding that, we are emphasizing simple measures, hand washing, social distancing, try not to come into contact with persons, gatherings, and so on, even though we haven't had it as yet, and we are considering some of these measures, but we are advising our public. There are things in our hands that we can do that can really reduce our chances, and both for us here in Guyana, but also across our region.
Yeah. Dr. Basad, what about the family members or anyone who may have come into contact with the first victim, so to speak, of COVID-19?
That was our first line of action. And what we've done, we've started with the passengers who came on that flight together with the couple, including our index case. And then we had started to move down to the contacts that the persons that came into contact with at the airport, all of the family members and the community members. So far, we have 2 households under isolation, and they are cooperating very well, I must say. We are trying to visit and with precautions, of course. Then, of course, our index case was cared for at the hospital over 2 days. So quite a few health workers also, doctors, nurses, and other health professionals, and even, persons who work within the institution came in contact. They were all also placed in isolation and are under observation, close observation. So it's quite a tidy bit of work, and it's not as easy to accept because it disrupts normal life in many, many spheres, and it causes a bit, it's not purely that, well, you have a disease, you give treatment, and that's it. There's so many other social and other consequences, and I guess I heard you a bit on the glaucoma issue. There are even some, other consequences that do plague persons who are affected by situations like this.
Yes, yes. All right. Well, Dr. Prasad, we're going to have to leave it there, but we want to thank you very much for joining us live from Guyana, and we'll continue to stay in touch with you as we continue to monitor what's going on with COVID-19 in the Caribbean. That was Dr. Shahadeo Prasad there, the Chief Medical Officer of Guyana. We're going to take in a few messages and come back here on the Now Morning.